I've been working at the finish line since 1975, and the day was perfect. Perfect weather. The occasional person would come in with dehydration, but we were all agreeing that it was a very light day for us, and we were happy.
My dad and I passed the 1 mile mark, and that is a glorious marker in the marathon when you have 1 mile left. And we were high-fiving each other. We were taking Twizzlers from children who were holding them out for us to get us through that last mile.
I was watching with some friends a little bit after mile 25 on the course, cheering for people. We love everyone who has a name on their shirt, just cheering as loud as possible for them.
The first alert came across my computer, and my immediate thought was, I really hope this is a drill. Followed 2 seconds later by the recognition that it's not.
We heard the explosion with about 800 meters left to go. We were just about to curve onto Boylston Street, and immediately we knew that something was horribly wrong.
We heard kind of the sounds, but there was a lot of noise that day. We weren't sure what was going on, so I went to my house. We turned on the TV, and that's when we saw it. They had on the news, they were showing the 2 blasts that had gone off.
I saw it and heard it because I'm about 15 yards away from it. Many of us reacted immediately and started running toward the first explosion.
I jumped the barricade and began sprinting towards the finish line, and I remembered thinking, I have to be there.
My first thought was, I need to call work and see if they need help. I'm right down the street. So I called the coordinator and said, do you need people? And she said, yes, get in here now.
In an event like this one, we needed to activate the hospital command group. There's really people from across the spectrum in the room.
The command center is the central location for information and getting status updates of what's going on to make sure that the hospital keeps running and that it's a safe environment.
As an institution that cares for injured children, we have a very specialized role to play, a role that other hospitals can't play.
We didn't know how many we'd be getting right off the bat. And when the kids arrived, they were really in pretty tough shape. We put in some IVs, we gave them some oxygen, and then started to look down their bodies from head to toe to see what had been hurt.
Everyone was just ready to get to work. We all knew exactly what we needed to do.
People dug in and got to work and with a common interest and a common goal. Get those people out to the hospitals as quickly as possible.
The OR, with nothing more than notice, was able to spin up 5 OR suites with full teams within the hour, ready to receive the casualties.
These were horrific injuries. I think about what happened to the families and the kids that we cared for here, and it's, I think, intensely personal for the families and for all of us in the healthcare business.
As a health professional, you're used to dealing with challenging situations, but not challenging that are man-made and clearly were something that was deliberately done. And I know from talking to my colleagues in pediatrics and in surgery, they were really distressed, not just by the challenge of the situation, but the whole context.
Even though there was so much that was devastating and traumatic and hard to deal with that week, there was another end of that emotional spectrum where people just felt such support and teamwork and pride.
Being in the emergency department that day, I'll remember how incredible the staff was, how strong the patients and families were, and how strong Boston as a whole was.
Whatever discipline you were in, just seeing everyone come together for the patients and families here at Children's.
So many people were affected on so many different levels, whether some of us were there, some of us were in the medical tents, some of us were in the emergency room, and some are still caring for injured today. We are a powerful team of people here, and there's so much good we can do. That's the attitude that I see people taking, and I know that's the attitude we'll move forward with.
We are
Boston Strong.
Boston Strong.
Boston Strong.
We are
Boston Children Strong.
Boston Children's Strong.
Boston Children's Strong.
Boston Children's Strong.